Hello, how you doing? I'm Dr. Matt Young. I'm president of the American Academy of Implant Dentistry. Today, we're going to be talking about our annual program this coming up November 12th to 15th in Phoenix, Arizona. We're going to have an awesome program with main podium, live hands-on workshops, limited attendance programs, and camaraderie. Today, we're very honored to have two great clinicians and educators. We have Dr. Shahram Ghanaati. He's MD, DDS, and PhD, who specializes in oral and maxillofacial surgery and holds certifications and board certifications from both the German and European boards. He is a professor at Frankfurt University and also Jacksonville University, and he's joining us today from Frankfurt, Germany. So we're very, very honored to have him today. And we also have Dr. Jim Rutkowski, who many of you know is our JOI editor. He's a researcher, clinician. He also has a PhD in biochemistry, and he's been one of our greatest educators in AAID. And to have them both combined today and to be able to do a hands-on workshop with venipuncture, blood draws, and properly handling and utilizing these components for use in our patients. With these two clinicians, it's going to be a home run for hands-on. So, Dr. Ghanaati, we'll start off with you. Tell us about the program and the hands-on workshop and what our attendees can expect.
Well, first of all, thank you very much for this opportunity, and also hello to everybody. And I'm really pleased and actually grateful for this possibility because Dr. Rutkowski and I have been experiencing and giving lectures and workshops already multiple times at AAID. And this time, I think the most important aspect is to be transferring the necessity of the ability to do venipuncture, not only for blood concentrates, but also in a way of a training to be able, for example, to take care of any potential emergency or any situation that the patient is in need in terms of, before the medical care arrives. And the goal of this hands-on workshop is to not only just show something, but to implement the importance of the application of the blood concentrates in dental offices. Because as you know, we both have done multiple years for research and spending time learning about the effects of the growth factors and the capability of regeneration of bone and soft tissue. And we would like to share this experience with the colleagues and show them that the patient itself can be the source for his own regeneration. In other words, the story is about to say how to prepare the patient in terms of micronutrition, hydration, to be the best donor for the technically blood concentrates to be again used in the sites of interest, which is in lower upper jaw, for different applications to be actually providing, the regenerative capacity that it needs to be healing. And I think that's a very important message because we know that for some sites, we really need a boost and we need a support. And nothing is better than an autologous source. And blood concentrates are technically the most effective, but also the most capable source for regeneration. So we are happy to share this knowledge and this experience along with all our expertise in clinical practice, but also in clinical research, specifically in the clinical application for the office to be transferred to the colleagues. That's the main overview about that workshop.
Well, it sounds awesome. The use of autologous blood and use of PRF, both liquid and the membrane, is gaining more and more acceptance in the medical field, in the dental field, and implantology field, and surgical field for sure. And our patients, I love that we're incorporating this kind of technology. And for an implantologist, you really should be incorporating this. Many times implementing a new technique or tool into your office can be challenging. And the venipuncture, learning from experts like both you and Dr. Rutkowski, will allow them to have this as an adjunct into their practice. When they get back after the meeting, they can start to do this right away. So it's not something that you have to wait months and years to develop. This is something with your techniques and skills they'll be able to implement.
Exactly, and specifically as we are now discussing with AAID to provide all the animations that we have generated for venipuncture for the colleagues to be using then after the courses in their offices. So it will be hopefully a situation that they learn everything they should learn in that workshop, but then when they go back, they would have it in an online manner in terms of streaming through the AID. This is what we are now preparing at the moment to be able to recapitulate and also for training of older stuff and all the potential new stuff and everything that's coming, because at the end of the day what we are aiming is to contribute the best platform for a continuous education. And I think there's nothing better and more experienced than AID in terms of education. So we both are, and I'm happy to also speak on your behalf, Jim. We are very proud for this opportunity to give this workshop, and we are happy and glad. So what do you think, Jim?
I think it's great, and the hands-on portion and actually knowing how to do it and having the resources once they get back home to do it. So many times people tell me I would love to use PRP or PRF, blood concentrates, concentrated white blood cells, which help reduce the chance of infection with your bone grafts tremendously, tremendously. I mean, I just can't emphasize that. Everybody's focusing on those growth factors, and we do need to focus on them. But we also need to be focusing on those white blood cells, those benefits, and white blood cells contain so many of the same growth factors. But they tell me, I'm intimidated on how to get the blood. I'm a dentist. How can I do a venipuncture? Well, by the time they get done with this workshop, and then also going home and using the resources that the AAID is going to be able to provide to them, there's going to give them the confidence they need to incorporate this into the practice. So it's not just, here it is, we're going to show you, and now you're on your own. No, there's going to be people there by way of streaming to assure you and your staff that they can do this. So I appreciate the opportunity to present with my dear friend, Dr. Ghanaati, and I thank the AAID for this opportunity.
Well, it sounds like the best possible type of learning. You have lectures by experts, you have clinical hands-on with experts guiding you, and then you also have a virtual component afterwards that you can refer back to and reinforce this not only for yourself but as a team. I thank you both for adding so much to this program, and I look forward to seeing everybody at our AAID annual meeting this November 2025 in Phoenix, Arizona.
Thank you so much. And one more thing that I need to say, there's also a book that we're going to present to the participants, because all the animations now we have in one book collected. It's a quintessence book. And it's going to be also another way for them to be just able to go through it. And because we both believe that understanding how to do the venipuncture is the first step towards understanding how to treat the patients from a medical perspective. With that said, I'm very grateful and I'm thankful for this opportunity also. And we're looking forward to see you in Phoenix, Arizona very soon. Okay?
Dr. Ghanaati, you're very world-renowned speaker, and you're associated with several universities. Why do you take time out of your schedule to participate with the AAID and its programs?
Oh, that's a very nice and very grateful question. I was privileged to receive the ICLU Award in 2014, which is a very, very prestigious award from the AID. And this is everything I do and everything I'm happy to also continue doing with AID is just a recognition of my appreciation and also showing my gratefulness to this very profound and very scientifically, but also, one of the most traditional societies in the US. So I'm very proud to be a part of it and also part of helping Jim a little bit in the editorial board for the journal. So it's like a very great privilege to be in this way a part of AID.
Well, it's a very well-deserved honor. The Isaiah Liu Research Award is our highest research award, and it helps to fund a lot of research around the world, drive the advancements of implant dentistry, and to have leaders like you who are pioneering has really made it predictable for us as clinicians and predictable for our patients. So we really appreciate your contributions and your ongoing support for the AAID and research as well.
Thank you so much. I'm happy to. We have much more things to contribute in the future. Very much. Thank you so much.
Well, thank you very much. I look forward to seeing both of you in Arizona.